Health and Human Services Secretary Robert F. Kennedy Jr. today called the continuing rise in autism diagnoses a, quote, epidemic. This after a new CDC report showed an estimated 1 in 31 children were diagnosed with autism in 2022, an uptick from 1 in 36 children in 2020 and 1 in 150 in 2000. Here is what the secretary said earlier today.
This is a preventable disease. We know it's an environmental exposure. It has to be. Genes do not cause epidemics. They can provide a vulnerability. You need an environmental toxin.
Okay. But medical specialists say the increase is largely due to an increase in the availability of screenings and services, along with the broader definition of autism and wider diagnostic criteria. So we want to bring in here Colin Killick, Executive Director of the Autistic Self Advocacy Network, a group founded by and for people with autism to advocate for their rights and improved education. Colin, here with me in the studio. Welcome in, sir. Thank you so much.
Thank you for having
being
me
here. I want to just read you something, and forgive me as I look down and read it to you. This is what the secretary said today. He said, quote, "Autism destroys families." And he went on to say it destroys children. I know this is a hard question, but what was your reaction when you heard him say something like that?
Disgust and fear, frankly. I mean, I'm an autistic person. I run an organization staffed entirely by autistic people. None of us have been destroyed. Our families are not destroyed. And obviously there are folks with much higher support needs than I do, but I know a lot of parents of kids with autism who have significant support needs. I wouldn't hear any of them say that their children or their families had been destroyed. And this rhetoric is frankly eugenic, and it promotes the worst kind of stereotypes about our community, promotes the lie that the lives of autistic people aren't worth living.
Is it your understanding that the tenor this administration is striking is saying that autism is a burden, whereas you're saying it's something that could be, a superpower in a way?
I mean, I wouldn't say superpower, but yeah, certainly they're painting it as a burden, right? And it's the old eugenic tagline: "Some people are born to be a burden on the rest," right? It's going back to the 1930s, and that's autism is a way of being, it's a way of thinking. It's a different. It's not a bug. It's a different operating system, is I think the quote, and it's different person to person. Some people are very good at some things. Some people really struggle with certain things across a whole variety of different axes.
So what we've heard from medical specialists is that the increase in autism diagnoses is largely due to better awareness, better screening, things of that nature. What do you see when you try to advocate for better education here? What do you tell people about autism?
Yeah, I think we tell them a few things. One, exactly that from 2000 to now, especially if you see those statistics, several other diagnoses like Asperger's were rolled into autism that used to be distinct, or things like nonverbal learning disorder. Many people who used to be diagnosed with that are now diagnosed with autism. And we've done a good job of going out and finding people. But the main thing we tell families and we tell autistic people themselves is your life is not hopeless. There are supports out there you can get. There are accommodations you can get. There are services available through Medicaid for autistic people, although those are going to get a lot harder to find if Medicaid gets cut under this budget. But yeah, we tell people that life as an autistic person is good. It can be hard, certainly, but it can also be joyous. And that above all, we tell them that there is an autistic community that they are part of and that they are welcome in.
Colin, a member of that autistic community, a leader in that autistic community, thank you so much for your time today, my friend. Thank you for joining us. Thank you for talking about all of this.
Thank you.